Next, we will test proprioception, which is the individual's perception of the relative position of the parts of the body.
Moving your toe up or down.
Grasp a finger or the big toe at the sides with your thumb and index finger and move it gently upwards and downwards. Have the patient tell you if the digit is up or down.
Down.
Other simple tests of touch perception include drawing a number on the palm of the individual's hand with a blunt instrument and asking them to name the number, and handing her a common object and asking her to identify it by touch.
Very good.
Reflexes are assessed using a reflex hammer. Most reflexes are tested by supporting the body part while asking the patient to fully relax, then tapping on the reflex point or on your own thumb over the reflex point with the reflex hammer. Use of the reflex hammer requires practice. Reflexes are graded using a numerical scale. 0 equals absent. 1 plus equals present but diminished. 2 plus equals normal. 3 plus equals hyperactive without clonus, and 4 plus equals hyperactive with clonus. Clonus, also called myoclonus, means rhythmic and rapid contractions in the muscle. Clonus is indicative of upper motor neuron disease. If the reflexes are hyperactive, you can test for clonus by supporting the lower leg in your hand and relaxing the muscles by moving the leg up and down. Then briskly dorsiflex the foot and hold. If the response is normal, there's no additional movement in the muscle. But if clonus is present, you will see and feel repeated rhythmic contractions of the muscle. Grading of reflexes is subjective, and as you assess more patients, you will develop awareness of what is normal and how much deviation from normal is required for concern. Testing of reflexes alone is not adequate for determining the presence of a problem, although absence of a reflex and 4+ are findings of concern. Areas commonly tested are at the inner aspect of the elbow, biceps reflex, the outer aspect of the elbow, triceps reflex, the inner wrist, brachioradialis reflex, the knee jerk, quadriceps or patellar reflex, the Achilles tendon reflex, and the plantar reflex. Testing the plantar reflex is done by using the tip of the handle on the reflex hammer to scribe an inverted J on the bottom of the foot. This should elicit downward flexion of the toes. Upward flexion of the toes, accompanied by inversion and flexion of the forefoot, known as the Babinski reflex, is an indicator of spinal or brain disease. While alterations in consciousness are often obvious and result in immediate intervention, it may be more subtle, and changes in cognition are frequently so. There are several tests which are helpful. The Glasgow Coma Scale is widely used in patients, particularly in the emergency setting. It provides a standardized objective assessment of consciousness using a numerical scale. It is divided into 3 segments: a 4-point eye-opening scale, a 6-point motor response scale, and a 5-point verbal response. This last makes the test ineffective on an intubated patient. In each scale, 1 equals no response to testing, and the highest number equals full response.